Clostridioides difficile. Okay, in the part of diarrhea, you have this chapter coming. Clostridioides difficile, previously called as Clostridium difficile. The new name is Clostridioides difficile. I think this change had occurred in Harrison 21 itself. That is the name change. So it's Clostridioides difficile. Now, what is the update? The update is that fidaxomicin is now favored over vancomycin. So that is the major update. So if you look at this particular table that you have come across, okay, make it large. So this is basically the treatment options for Clostridioides difficile infections. So we have here the clinical setting, the treatment, and the comments given. Okay. So here what you have to see that you have a initial episode, mild to moderate. Initial episode, mild to moderate. So the first treatment option given here is fidaxomicin, and vancomycin is now given as an alternative option. Okay, so the first choice for the treatment of first episode of CDI, that is Clostridioides difficile infection or pseudomonas colitis, is fidaxomicin. And as a comment, we have mentioned that oral metronidazole is less effective than the other options and should not and may necessitate a longer treatment course. So metronidazole should only be used if you don't get vancomycin or fidaxomicin. So, and that too only for mild to moderate disease. So metronidazole is not a favored disease. Option for the treatment of CDI. So the drug of choice became fidaxomicin. So this became the same for initial episode, severe as well. So how do you decide a severe disease? Severe disease is defined as a leukocytosis, that is like total leukocyte count like more than or equal to 15,000, or creatinine level which is more than 1.5 milligrams per deciliter. If any of them is there, you can consider it as a initial episode as severe. Here you can see that the first option that is given is oral vancomycin, or alternatively fidaxomicin is given as the option. Okay. So if you look at the the initial episode, which is severe, okay, that is indicator severe disease include leukocytosis or a creatinine more than 1.5. The first option given here is oral vancomycin. Okay, so mild to moderate disease, the first option is fidaxomicin. For initial episode severe, oral vancomycin is given as the first option, and fidaxomicin is given as the alternative. Now, if you have an initial episode which is fulminant, so how do you define fulminant? A fulminant CDI is defined as a severe CDI with addition to any of the following, that is, they have hypotension, shock, ileus, or toxic megacolon. And in such cases, the treatment option given is a high dose vancomycin, that is vancomycin 500 milligrams via nasogastric tube, but the patient may have ileus, that is, the intestinal motility may be reduced and the vancomycin may not reach the colon. So then you give plus metronidazole given as IV, and then you consider rectal instillation of vancomycin as well. So just learn these three from this particular table. So that is like fidaxomicin is preferred as the first agents for mild to moderate disease. Okay, and metronidazole should not be used for the initial episode which is severe. Okay, there you can use vancomycin or alternatively fidaxomicin. And initial episode fulminant, that the patient has hypotension, ileus, or toxic megacolon or shock, then you have to use vancomycin given as 500 milligram via nasogastric tube plus metronidazole given as IV plus rectal instillation of vancomycin. The another MCQ that you can get is that here in this table, this is there in the previous Harrison also, in patients at high risk of recurrence who are receiving vancomycin, fidaxomicin or metronidazole, additionally a monoclonal antibody can be given, which is against toxin B. This monoclonal antibody is called as bezlotoxumab. Okay, this is another MCQ that you can get. Now you should understand why fidaxomicin is preferred. So oral administration of fidaxomicin is suggested as the first line treatment for CDI because there is a comparable clinical resolution of diarrhea in the patients receiving fidaxomicin and vancomycin. Both has a success rate of 90. Then why is fidaxomicin preferred? Because the rate of recurrence was significantly lower with fidaxomicin. So that is the reason why it is preferred. Now remember that fidaxomicin is a new drug and it is very costly, and because of the availability issues, it's not still available in India, oral vancomycin remains an acceptable alternative. So